Good afternoon and welcome everyone. I am Ayana Teal, the Administrative Coordinator for the Mid-Atlantic Public Health Training Center. And on behalf of the Training Center and the Maryland Department of Health and Mental Hygiene, we'd like to welcome you to the October 17th Public Health Practice Grand Rounds, Making Health Reform Happen, How Maryland is Implementing the Affordable Care Act. I have a few announcements, especially for those watching online. If you could take the time out to sign in for us, that would be greatly appreciated. It's just a few questions that will take less than a minute. We just want to let our federal funders know that people are actually tuning in and watching us today. Right under that link is an email link. You can send an email question or comment at any point during the presentation, and we will have a Q&A session immediately following the presentation. And then at the bottom of the screen, there's an evaluation that you can fill out after viewing the presentation to give us feedback so that we can improve and meet your needs better. We are very happy to have with us today Carolyn Quattrocchi, Rebecca Pierce, and Vinnie DeMarco. I'm going to introduce Vinnie, and he will introduce our other speakers. Vinnie DeMarco is a longtime advocate for public health causes, including reducing teen smoking and gun violence, and expanding healthcare access, and the subject of the new book by the former FTC chair and Advocacy Institute co-founder, entitled The DeMarco Factor: Transforming Public Will into Political Power. You really should pick up this book. It's great. As president of the Maryland Citizens Health Initiative, he's working to guarantee quality, affordable health care for all Marylanders. And as an adjunct assistant professor of the Johns Hopkins Bloomberg School of Public Health, he is working to educate public health students from around the world on effective methods of advocating for public health policies. And I also happen to personally know that he sends his wife flowers just because, and that's the stuff that really counts. So if you all would welcome Vinnie DeMarco, and he'll introduce our other speakers.
Thank you, Ayana, for the sweet introduction and for hosting this. We love the Maryland Public Health Training Center, and Ayana does a great job there. And thank you all for being here in person or by webcast. We're here today to talk about the Affordable Care Act, otherwise known as Obamacare, and how it's being implemented and going to be implemented in Maryland. As we all know here, I hope, the Affordable Care Act is a great public health victory for America. It's going to expand healthcare to over 30 million people who didn't have it, make healthcare more affordable for all of us. A tremendous public health victory. Presidents have been trying to do that since 1900, and we got it done under President Obama, and it's a great victory we should all be very proud of. One of the things, though, about this law that's important to understand is that, especially after the Supreme Court decision, there's a lot of discretion in the states. States have a lot of discretion on how they implement the Affordable Care Act, which in our country is a very important way to make laws work. And we want to talk here about how this law is going to be implemented and has been implemented in Maryland. 2 days after President Obama signed the Affordable Care Act, Governor Martin O'Malley, Lieutenant Governor Anthony Brown, and Secretary of Health Josh Sharfstein held a press conference to say, we in Maryland strongly support that law, and we're going to do everything we can to take full advantage of it and fully implement it here. That was very important to those of us in the advocacy community who want this law fully implemented. I have colleagues across the country who grind their teeth about what's happening in their states, who are so upset about states where the governor and the legislature either are slow in implementing the law, or tried to sue to get it repealed, or not fully funding it, or just really negative on the law. And they're all jealous of us, as they should be. We in Maryland are really doing this right. After the governor held that press conference, he did one very important thing, is he chose a woman named Carolyn Quattrocchi, who I'll introduce in a second, to be the head of the health reform office that he put together, and he created task force to figure out how to fully implement this law. There are two parts of the law that really now have a lot to do, that states have a lot of discretion on. The Medicaid, which you'll hear about, expansion, and the exchange. The exchange, as you'll hear more about, is a way that we can make healthcare affordable and accessible to many, many thousands of Marylanders, millions of Americans. But states have a lot of leeway on how to put together that exchange and make it happen. So in Maryland, the governor, Lieutenant Governor Brown, Secretary Sharfstein put together a task force in which advocates like myself, consumers, business, labor, people from all across the state came together. Matt Chaltano, our deputy director, was heavily involved in this, and we all talked and figured out how to fully implement the exchange, how to make it happen. I can tell you it was a tremendous process. Many of you in this room and on email have been part of it and are part of it. It's a lot of work, but it was really open, transparent, and a great public process to make this happen. And through these processes, we passed 2 laws in 2011 and 2012 to begin to fully implement the Affordable Care Act through the healthcare exchange. And the great thing, couple great things happened. A board was created, chaired by Dr. Sharfstein, who's absolutely amazing and wonderful. And the members on that board are really consumer-oriented, great people. And they hired a tremendous person to head it, to be the staff person, Becca Pierce, who we'll introduce after Carolyn. So they have a great board, a great staff, and laws which are really designed to fully implement it. One thing I just want to mention before I introduce Carolyn, one of the key issues in an exchange is whether the exchange is going to have the power to really make healthcare affordable. And there's always opposition to that by people who kind of like the status quo exactly as it is and benefit from it. So we had to really fight for that. And the O'Malley Brown administration and many of us advocates really fought to make sure that the exchange has that authority, something called active purchasing, which the Massachusetts exchange has and is working well. And we have that in Maryland. So we have the structure now to really fully implement the Affordable Care Act in a terrific way. You're going to hear now from Carolyn and Becca, who are going to tell you in detail how this law is being implemented here, and then we'll take questions after they're done. We are very lucky to have the 2 of them here. They're amongst the nation's best healthcare leaders. And Carolyn, I want to introduce first, a longtime friend of mine. We worked together in the Attorney General's office. She was a longtime assistant to Joe Curran, where she worked on many issues, including, I remember fondly, trying to reduce gun violence. She did a lot with the Attorney General on that. She a law degree from Yale University and BA from Northwestern. She's clerked for federal judges, worked at private law firms, and before her present job was the legislative assistant in the legislative office of Governor O'Malley. And in that office, she did a lot to help us enact in 2007 substantial healthcare expansion in Maryland, going from 34th to 14th in healthcare coverage for people, expanding healthcare to over 300,000 people. Could not have happened without Carolyn's work. And a lot of what we did that year helped to lead to the Affordable Care Act. And now, as I said, we're really thrilled that she was chosen by Governor O'Malley to be the director of the Office of Health Reform. And I want to introduce and we're all going to listen to eagerly to Carolyn Kotrocki. Carolyn?
Well, you all don't know what a feat it was for me to just walk across the stage like that. First of all, thank you so much, Vinny. I'll get to in a minute how important Vinny and his advocacy organization, Healthcare for All, has been to our efforts. But I want to say, just on a personal note, first of all, I'm really happy to be here. I was supposed to give this talk back in July. And some great people stood in for me at the last minute because I actually, ironically, at a healthcare reform conference out in Portland, broke my leg really badly. And so I want to also give a shout out to my wonderful surgeon, Dr. Greg Osgood, just down the street, who just this morning, coincidentally enough, said I can junk these crutches as long as my, as soon as my leg is strong enough. So I'm on my way back, so that feels terrific. I'm going to give you sort of the overview of all the various things we've been doing, and then Becca will go into a lot more detail about the health benefit exchange. I always start off talking about this to make a note that as we have moved forward on a lot of different fronts, we really have tried to keep in mind the goal, not just making reform happen for its own sake, or even to expand coverage for, to make sure people are covered for its own sake, but to really try to improve health. And I think that's important when you look at all the various arenas that we have to be operating in to make this implemented effectively. The other thing I have to emphasize from the outset, and I'll come back to this because it informs and infuses so much of what is happening and has happened, is that we tried from the beginning to take a very collaborative approach. This kind of change affects everybody. All of the stakeholders, the providers, the carriers, the small businesses, the consumers, the individuals, the advocacy organizations. We didn't want it to be just sort of what we in government think ought to happen in terms of implementing this law, but we've really, I think, to the extent that we've been successful, and we're proud of it, it's been because of the input of so many terrific advocates, and that's where I'll give kudos to Vinny and his leadership and his organization, among many others, but they have been particularly terrific in helping us, at key moments, getting active purchasing authority for the exchange, and those kinds of key moments when you really need people to step forward and say, this is the right thing to do. In sort of understanding what we've done and are doing, we sort of think of the Affordable Care Act as having sort of four basic components. The first is the insurance market reform, so that coverage that people are going to get will be meaningful. And you're familiar with a lot of these things that have already gone into effect. I have personal experience with keeping kids on insurance policies till age 26. No lifetime limits anymore on benefits. You can see there I've given statistics on how many Marylanders are already benefiting from these reforms. In 2014, the one you hear most about, no longer any exclusions for pre-existing conditions or annual limits. Women will no longer be discriminated against in terms of premiums they pay because they're women. And then preventive services, which are so critical to reducing costs and keeping people healthy in the first place. A lot of additional preventive services available at no cost for women, again, in particular. The second piece is expanding access. The Medicaid expansion, I've given you numbers up there. These are our sort of best projections as to how many people we'll be able to cover by the end of the decade under the Medicaid expansion and then through the exchange, again, which you'll hear a lot more about. So if we do this, as effectively as we can, we hope to reduce our number of uninsured by half by 2020. The third piece is, you can't, as we learned, as we all focused on with the Supreme Court decision and the individual mandate, you can't force people to buy insurance and have insurance if it's not affordable. So the Medicaid expansion up to 133% of FPL is really critical in that regard. The small business tax credits, making it easier for small employers to provide coverage. And then, of course, the tremendous influx of assistance from the individual subsidies through the exchange. The last piece, which in the long run may be the hardest one of all, all of this is not going to be successful in the long run if we can't reduce the underlying costs of why coverage is so expensive, and that's the underlying cost of healthcare itself, and enhancing the quality at the same time that we're making it more efficient and less costly. So it's one of those things you have to sort of attack from all different angles, and a lot of it, has to come organically from the private sector. But the categories of sort of wellness and prevention and the new care delivery systems that are being, pioneered in institutions like this. And then health IT, which has been a priority of the governor from the beginning, even before the Affordable Care Act was signed. But we need to take advantage of those new advancements in technology to work towards this goal. So how have we brought these benefits to Maryland? As Vinny said, from detractors of the Affordable Care Act, you hear a lot, it's this federal takeover of healthcare, top-down kind of thing, but it really isn't. I mean, it puts the tools in place for states, but states really have a lot of discretion in how they implement this act. So as Vinny said, the governor, a couple days after the Affordable Care Act was signed into law by President Obama, he signed an executive order which created a bipartisan joint legislative and executive branch coordinating council with, the key health policy and budget leaders in the state, and charged that council with taking a hard look at the Affordable Care Act and working with a lot of stakeholders, 6 different work groups, many meetings over a period of a year, come up with a set of recommendations as to how we can best implement this law here in Maryland. Those recommendations are sort of divided roughly into 5 categories. The first, which was really the last, but they recognized through this long process that this is a complicated, sort of ongoing, long-term undertaking, and that it would benefit with ongoing leadership and coordination. So that led to the creation of my office, and also extended the life of the Coordinating Council, which was originally just going to be in existence for a year, but is still ongoing and active. The second category, the exchange, the insurance market reforms, which I've talked about, and Medicaid expansion. I'm going to give very short shrift to this because Becca's going to go into a lot of it. But we were one of the first states in the country to pass the initial law that established the governance and structure of the exchange. As Vinny said, they've gotten up and running. One thing that we did have a lot of sort of back and forth about, and ended up with a hybrid of, there were those that thought it should be a nonprofit, those that thought it ought to be a government agency. So we really tried to take the best of both worlds. We wanted there to be that sort of inclusiveness and accountability that is associated with government, but to have more flexibility in hiring and procurement than strictly state agencies. So I think we got the best of both worlds in that regard. We have a terrific board of directors and a really terrific executive director, as you will see in a minute. Those are some of the policy decisions that we implemented in the second act, the second piece of legislation that was passed this past session. And again, Becca will talk more about that. Here again are just the numbers on the Medicaid expansion and the subsidies. And just a quick point about this. Again, contrary to what you hear from detractors of Obamacare, we did an independent study, and we didn't do it, but we commissioned an independent study of what the economic benefits of the exchange and the Medicaid expansion would mean for Maryland. And as you can see from this chart, we're getting this huge influx of federal dollars into the health system that will then, in turn, as people get covered and access care for the first time in a more sustained way, will increase expenditures and create new jobs. So the next category, again, as I said, maybe in the long term, the toughest nut to crack, healthcare delivery and payment reform. Right here, there are a number of initiatives going on, again, ongoing. One of your own, John Culmers, who was the former health secretary, and the current medical director, they're co-chairing a committee that's really trying to take a look at the clinical innovations that are being sort of, that various providers and health systems are experimenting with and trying to make work, marrying them with the financial incentives and mechanisms, and then into integrated programs, trying to shine a light on those programs that are really holding a lot of promise, that show that they are in fact going to be a good way to go. We created actually before the Affordable Care Act, the Health Quality and Cost Council, which is again is a group of folks taking a look at, again, a lot of these issues. One of their big initiatives was a medical home pilot, an all-payer, patient-centered medical home pilot, which is up and running, and CareForce, of course, is doing another one. A very important initiative last year was to really focus on and try to reduce health disparities, not only because it's the right thing to do, and we have a lot of health disparities still in Maryland, but also it's a cost driver, and so it's, again, another way to sort of try to deliver care, better care for less money. Balancing incentives payment program, we got a grant for long-term care reform, and there are a couple of other examples up there. The next category, even if we do this incredibly, effectively as well as we can, unfortunately, we still will have thousands of Marylanders who will remain uninsured. Undocumented immigrants are one category, but there will be others. And so it's important that we maintain and enhance the strength of our public health system, our safety net providers. And you see there are a number of initiatives going on to try to do that. We're getting grants from the federal government to this end, more money for community health centers, which is obviously really important in this regard. Next, workforce development. You know, the good news is we'll have all these additional folks covered and accessing care, but that doesn't, that doesn't get you there if you don't have the providers to provide that care and the right kind of providers to provide the right kind of care. And again, that's where we feel like we really have to try to marry the delivery system reform with the workforce development initiatives. So we've taken a kind of comprehensive look at it through the Governor's Workforce Investment Board, and we're just now trying to start trying to look again. We've been sort of focused on these deadline-driven developments that we've had to meet these federal deadlines, and this one doesn't have a deadline, and it doesn't have quite the script in the Affordable Care Act. But we think that again, workforce development initiatives have to come from the private sector, but we're really trying to take a look at what we can do in government with our stakeholders to help facilitate that. Look at aligning training opportunities with the new delivery system models, better data collection, and maybe looking at some barriers to credentialing and licensing. Last category, communications and outreach. This again is where Vinny's group and a lot of advocates come in to really help us leverage this effort. But all of this great stuff that's going on and the benefits of the Affordable Care Act that are being brought to Marylanders, again, you need people to know about it, to understand it, and to know what they need to do to access it. So we're working, and increasingly the exchange is standing up a really comprehensive marketing effort. This is our website, our new that we launched about 6 months ago, I guess, that we really tried to make more consumer-centric and divide the groups of consumers, small businesses, families, and individuals, and seniors, to give them a way to sort of really understand what it means for them and what they need to do to access the benefits. And then Maryland, moving forward up there, if you're interested as a stakeholder in these policy developments, that there's a special section for stakeholders. Last thing I'll talk about, essential health benefits. We just completed this task. The Affordable Care Act requires that every policy in the individual and small group markets beginning 2014 that will be sold will have to contain a core set of essential health benefits. We expected the federal government to define this set of benefits, but for the first 2 years, they've directed states instead to pick a plan, existing plan in their state from among 10 options, and that benchmark plan will serve as the core set of essential health benefits for Maryland. All plans must cover the 10 categories of services you see up there. And just last month, September 27th, the Coordinating Council selected the State Employee Health Plan as our essential health benefits benchmark plan. So with that, I will wait for questions till after Becca speaks. And thank you.